A warm welcome to you all. I'd like to commence by acknowledging the lands on which we work, and this presentation is being recorded, the lands of the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging. In today's session, you will hear about the graduate programs in clinical research, a program that we're proud to run through the Melbourne Medical School and the University of Melbourne. My name is Associate Professor Anita Horvath. I am the Clinical Research Training Lead in the Department of Medical Education and the course convener for the graduate programs in clinical research. In today's session, we'll also be joined by Dr. Munira Hussain, who is also one of our leading educators and a senior lecturer in the graduate programs in clinical research. We are passionate advocates for clinical research and for developing the next generation of clinical researchers, whether you are coming from a clinical background, a biomedical background, or another health sciences background. We are very keen to develop and establish your clinical research skills. I'd now like to introduce you to our clinical research program. This program offers our learners a flexible pathway of learning. You can either commence at the graduate certificate level and then move your way through to the diploma and master's level, or you have the option of directly enrolling into one of these separate courses, whether it's the grad cert, the grad dip, or the master's. At the foundational level, which is within our graduate certificate, we have 4 subjects. The principles of clinical research, study design in clinical research, in which learners learn about quantitative research methods, qualitative research methods, as well as mixed methods. Responsibilities in clinical research, where learners learn about the ethics and ethical design of clinical research programs and undertake GCP training, as well as another subject on data analysis in clinical research. These are our 4 foundational subjects that are undertaken as one course at the grad cert, but is also available in our graduate diploma and master's level. At the graduate diploma level, learners are expanded in their knowledge in developing a research project and also are exposed to knowledge translation principles. It is really important to understand how you can implement a clinical research project, how to establish teams that are involved for clinical research, and the legal governance and responsibilities in implementing a research project. And we also examine how we can take our research data and bring them into practice. It's really important for us to think about all the wonderful research findings that we generate in clinical research, but we also want to see that those research findings are utilised by patients, by healthcare providers, and by our organisations and our systems that rely on clinical research data. At the graduate diploma level, learners also have the option to undertake electives. These electives include advanced clinical trial design, clinical research proposal, the digital transformation of health. As we know, digital health is an emerging area within clinical research, and you also have the option to undertake clinical leadership. For those that are really interested in implementing a research project, those options are available at our master's level, either through the clinical research pathway. So learners have a choice to either take a clinical research thesis or the capstone pathway, which is an opportunity to work on an industry project in an industry setting. And this is a very novel pathway at the master's level because learners have the option to choose between these 2 areas. One of the most distinguishing features of our master's program is the opportunity to tailor your program to best suit your personal future career pathway. You may be keen to build towards developing an independent research pathway as a future principal investigator, or you have a project that you want to implement in your current clinical or healthcare practice. Then the thesis pathway is most probably for you. However, if your end goal is to become better aligned with industry and to springboard your career into the clinical trial research industry, then the industry pathway may be best suited for you. Whatever the pathway is that you want to choose to take, we are here to support you to grow both as a learner and to aid you in this important decision-making process. By undertaking your Masters, you'll have the opportunity to undertake your project at our world-leading biomedical and clinical research precinct. Our program is centrally located within this precinct and surrounded by leading clinical sites including the Royal Melbourne Hospital, the Royal Children's Hospital, the Dental School, which is just up the road, and all our other allied health partners. This is in addition to the leading research institutes that are right on our doorstep, including the Victorian Comprehensive Cancer Centre, the Doherty Institute for Infectious Diseases, the Howard Florey Brain Institute, and the Walter Eliza Hall Institute. These are just to name a few. Our students have the opportunity to study, undertake their projects at one of these amazing sites. And you will also have the opportunity, if you undertake the industry capstone pathway, to study within research industries, whether it's emeritus research or veritas research. Either way, regardless of the pathway that you're passionate about undertaking, we are always here to support our students to help guide you on this journey. I'd now like to talk to you about the clinical research thesis pathway. This pathway within the master's level allows students to undertake a research intensive subject with an experienced supervisor in a research area that is of particular interest to them, and has the opportunity to work at one of our research institutes or at one of our clinical sites, working alongside an experienced research supervisor within a research team. And through this process, you will be involved in the development and design and the reporting of a research project. In this pathway, students will be required to complete a research thesis of up to 11,000 words. And so in this pathway, students take a deep dive into the research process and have the opportunity to complete a large piece of research work. I'd now like to hand over to Dr. Munira Hussain, who will tell you a bit more about our industry capstone pathway.
Thank you, Anita. So the students, by undertaking this capstone pathway, you will gain practical experience in key aspects of clinical research management. That means that you will learn how to do participant recruitment, data management, budget planning, project governance, etc. Also, the beauty of this subject is that you have the opportunity to build professional networks through industry engagement. That means you will be able to know how others are doing this research and how you will implement these things in your practical field. Thank you for listening to our session. If you have questions, please feel free to contact us using the email listed in this website. Register for one of our upcoming information sessions where you will have the opportunity to ask questions. Thank you on behalf of Associate Professor Anita Horvath and myself.